This question came from another physician who commented on my video about melatonin, and he asked, why not use Ramelteon or Rozerem instead of melatonin? I thought that was a great question. Melatonin or Ramelteon? Do you know which one is right for your patients and when to use which? In this video, we're going to look at the differences. If you're a physician or a healthcare practitioner who wants to uplevel your sleep medicine knowledge, go ahead and subscribe to this channel. I'm Dr. Nishi Bhopal. I'm a physician. I'm board certified in sleep medicine and psychiatry. This channel is for you to learn quick, easy, practical clinical tips about sleep medicine that you can use in your practice. Before we jump into this video, if you ever do use melatonin in your clinical practice, you need to be using third-party tested supplements. So I'd like to invite you to get my free melatonin brand guide. You can get that at intrabalance.com/melatonin. And that way you'll know which melatonin supplements are third-party tested, the different brands and formulations available. So you need to have this if you ever use melatonin in your practice. Okay, so let's compare and contrast and Ramelteon, which is a medication also known as Rozerem. Melatonin is a hormone. It is the major chronobiotic hormone that regulates the sleep-wake cycle. It's produced by the pineal gland in the brain. It's also produced in the gut. With regard to sleep-wake cycle, the pineal gland produces melatonin in response to darkness. It is commonly used in clinical practice for circadian rhythm disorders. It's indicated for things like delayed sleep phase syndrome, advanced sleep phase syndrome, shift work disorder, jet lag. It's also indicated in pediatrics for children with autism, ADHD, and other neurological conditions. There's other uses for it as well, which I'll get into in a moment. But a key takeaway with this is that melatonin is not a sleep aid. The way that I explain it to patients is that it's a body clock regulator. We use it to regulate your sleep-wake cycle. For circadian regulation, we're usually using doses of around 0.5 milligrams of melatonin. Higher doses can be used for other conditions like REM behavior disorder, and I might use it as a sleep support in slightly higher doses as well, like 2 or 3 milligrams. We're not going to go into melatonin usage strategies in this video, but I just wanted to give you a little bit of a framework about how to think about Next week, I'm actually doing a free masterclass on sleep supplements. We'll go a bit deeper into melatonin, so if you're interested, go ahead and sign up for that. The registration link is underneath this video. Okay, so let's talk about Ramelteon a little bit, also known as Rozerem, which is the brand name. This is a melatonin receptor agonist. It works by binding to the same receptors as melatonin, but it has a more targeted action on sleep regulation. It's a highly selective agonist for the melatonin MT1 and MT2 receptors, which are primarily located in the suprachiasmatic nucleus of the hypothalamus, which is the master clock in the brain. It is FDA approved for the treatment of chronic insomnia, specifically to help with sleep onset. It's thought to have fewer side effects in terms of next day grogginess or buildup of tolerance. However, a limitation of it is that it does not address the root causes of chronic insomnia. I have another video on why sleeping pills are not effective for chronic insomnia. If you haven't seen that, go ahead and check that out after this video. So melatonin is not indicated for management of chronic insomnia. That's a recommendation from the AASM. I'm going to go into more detail about that in next week's masterclass. Ramelteon is indicated for sleep onset insomnia, but as I've said before, medications are really not all that effective for managing chronic insomnia. So in my practice, I actually use a lot more melatonin because it's so versatile and there's more uses for it compared to Ramelteon. I think I've just prescribed it a couple of times. And to be honest, like with most sleeping pills, I don't find them to be all that effective because they don't really get to the root of what is driving the chronic insomnia. So going back to the question posed by my colleague, which is, well, if you're using melatonin, why not just use Ramelteon? Ramelteon is suggested as a treatment for sleep onset insomnia in adults. It is FDA approved for that. However, the American Academy of Sleep Medicine AASM guideline for treatment of insomnia says that this recommendation of using Ramelteon is weak, indicating that even though there is some evidence supporting its use for sleep onset insomnia, the strength of the evidence is not robust. Ramelteon can be considered as a treatment option for sleep onset insomnia, but clinicians should weigh this against other available treatments and consider individual patient circumstances when making therapeutic treatment decisions. So all of that to say, there is that one specific use case for Ramelteon. With melatonin, we'll be using that more for circadian regulation. There's potentially use for it in menopause, in patients over the age of 55, for patients on melatonin depleting drugs, in pediatrics, REM behavior disorder, and other indications. So there's a lot more versatility for the use of melatonin compared to the one indication for Ramelteon. So if you're wondering about Ramelteon versus melatonin, they have different indications and different use cases. To go deeper into sleep supplements and learn more about melatonin, melatonin, join my free masterclass next week on sleep supplements. The registration link is underneath this video. I would love to see you there.